All right, thanks for having me.
Take care.
All right, wash your hands.
Bye-bye.
Okay. There you go. 6:52, and yeah, let's keep it going with the white coats. The white coats are coming. Dr. Shieh, good morning.
Hey, good morning, Chris.
Yeah, I just wanted to catch up with you. It's been a little while, and just what are you making of the latest trends with the COVID-19 and the testing and the results that we're seeing?
I think we're testing dead viral particles, if you ask me, because I'd like to see more history on the positives. For example, we know that they have no symptoms. That's for one thing. If it's a tracing type of a test, we'd like to know when was the last contact with positive. If the last contact was more than 2-3 weeks ago, why even test? Because by that time, you're not going to test for any kind of active infectious particles. You're going to be testing with dead viral particles. And I think one of them said that came from off island or something that tested positive. Mm-hmm. Again, asymptomatic. So you have to ask for when was the last contact. If it was over 2-3 weeks, I don't think you need to test in particular, especially if they're asymptomatic. Sure, you can have asymptomatics that can transmit, but if they're doing contact tracing, if they're over 2-3 weeks, I don't think they should mix that up with considering that as new cases. I think you kind of mix up the picture, yeah?
Yeah. What do you think, though, about us seeing an increase in the testing currently, like with the expanded testing? They're going out into the community. More than 200 people were tested in Jigo alone.
I think that's good. I think, they're expanding the testing. I think it's good. I think our positives right now, if you really look at it, the entire population of Guam is less than 0.002%. I think that's what the rate is, which is very low. And those positives, like I said, if they're over 2 to 3 weeks, asymptomatic, I would put them in a separate category rather than bunching them up saying new cases. Because if we really want to open up Guam to tourism, etc., we need to make sure that the message is carried out the right fashion, because you're going to have people that don't want to come if they're still hearing, hey, they're still positive. Look, they're still new positive. Let's not go there, because what did public health say? If there's one positive, it can spread to 3, and then 3 into 9, 12, whatever it is. So we have to be careful with the type of message that we send out. Don't conflict the message. Be consistent about it.
What do you make of that, Dr. Shieh, where the governor and former Governor Gutierrez had come out and said, hey, we're opening tourism July 1st, and then less than a week later, we saw this surge in South Korea, and they kind of turtled in that, okay, we're going to back to the drawing board. So it's hard to talk about fixed things like opening tourism when there's so many things that are fluid that we're depending on for it.
Well, I think I'm hoping that by this time, summer is coming already, or summer is already here. It's so hot that this virus has gone to a different type of virulency, which means that it's less virulent. That means, when you get infected, it becomes a common cold, simple flu, rather than making you real sick. Because I really don't look at the number of positives per se. I look at the number of hospitalizations, and so far we have 0. Mm-hmm. GMA has been 0 for months, I think. So I think that's a good thing. And across the country, it's going down. Now, I don't know about these riots. Those are something else. But I think what we need to do is look at the hospitalization rates. And if we're going to be prepared, we'll be prepared not in the clinics. We have to prepare the hospitals, both hospitals, GRMC and GMH. Those are the areas where we need to really build up and be prepared for any kind of onslaught. If there is COVID-19 that's making people really, really sick and that need the beds. But, they got 2,000 beds, tents that's set up. I don't know if even one of them is even occupied. So I think they can start putting away those tents and then bring them back out if there's a typhoon or something. But I think we need to just kind of sit tight, wait and see. But here's the question, is whether or not Guam is going to brace itself for a recession, because the private sector, we're trying to get back on our feet. But, Gulf Guam needs to kind of start trimming some fat, because the private sector is already trimming themselves, cutting down hours for people, getting people back to work in a limited fashion. I think Gulf Guam needs to look at that, because we cannot keep supporting a big, fat government system that we cannot afford. And the GRT issue too. If we really care about a GRT, the GRT 5% is supposed to be only 6 months temporarily. And if our governor is saying that, hey, we have enough funding, then certainly they should roll back the GRT from 5% to 4%. And that's something that then you should really seriously consider. Yeah.
Yeah.
Well, I think the governor's kind of made it clear that she doesn't plan on
Furloughing anybody
yeah.
unless they have to pay the double pay, and then it's
Right.
like, oh,
Well, again, there's a government. The community, I guess, is segregated now, right? The community is segregated. That there's a government system and there's a private system. So you don't want that segregation because you want to make sure that we are all on the same page. If you expect the private community to, to lay off or to cut back hours and stuff, the government of Guam has to do its job, because if you don't, then you're going to have a too segregated community.
yeah.
Private,
But I mean, at the same time, Doc, we don't want to just fire everybody in Gov Guam because the private sector is not working.
No, you don't want to fire everybody, but times have come where you have to look at what you think is essential to keep the government going. You don't need one person that's non-essential and just sitting there, and making money that we don't really need. You have to run an efficient government.
Right. That I agree with. I mean, we saw that there were so many agencies that were non-essential. That were closed during the COVID, and they were so non-essential that they could shut down, and their directors could go work at a quarantine hotel for, a couple months, and there was no impact. It's not like, people were crying, "Where's the Guam Energy office? We can't do anything with the Guam." Nobody.
Right.
It was negligible. So you're right. I mean, there are places to trim, but I just don't like it when we talk about trimming the rank and file, because you could trim 3 rank and files, and that equals the pay of one unclassified director. So I just say, let's cut. You want to cut the fat? Well, the real fat is at the top. You know what I mean?
Well, yeah, you got a point. But we always saying that, hey, we can't renovate labor and delivery. It costs $10 million. But then again, you have a payroll over $10 million of some worker that's not essential. What's better for women and children, for generations to come? Or are you going to keep supporting a fat government?
Yeah,
Yeah,
Doc, and it really seems like the gov is just firm on the no furloughs, and I feel like, she could have thrown the private sector a bone and maybe been a little more empathetic and said it in a way that was sweeter than it sounded.
Yeah, you have to overhaul the government system. You can't run a fat bloated government and then expect the private sector to keep the government afloat.
Right. Well, I think there was an attempt, I think, when they tried to get rid of deputy directors, but that didn't work out.
Yeah.
So well.
And then the legislature caved on it because it's a Democrat governor. So, I
really don't understand this positions in the government system anyway.
Yeah.
But, getting back to, how to run a government more efficient, you have to think. You have to think of put on your business hat and start looking at how do you save Guam money, because ultimately, if you save government money, you also save the private citizen, the working people money, because there'll be less taxation to support a bloated government. Yeah.
Man, Doc, you've been a bit. I want to switch gears just a tad bit here, but you've been really busy. I mean, you're one of these docs. Like, people have been delivering babies. COVID came. Yeah. It's not like they said, no more babies.
I've been on Guam for nearly 24 years. I'll be in August. I arrived at the U.S. Naval Hospital Guam in August of 1996. And the first baby, ironically, I did not deliver at Naval Hospital. I delivered at GMH, because at that time, Dr. Chris Perez called me and said, "Hey, Tom, listen, you're coming in from Hawaii. We'd like you to moonlight for us on the weekend." So the first baby I delivered actually was helping Dr. Chris Perez doing a C-section. So it's a long journey to get here, but I never really wanted to come to Guam.
Well, thanks.
No, I'm serious. I hated it. I hated the idea that I'm active duty orders and said report to the island of Guam. I had to look it up on the internet to see what it is. And at that time, the internet took 5 minutes to log in. It's like, and when I log in, all I got was brown tree snakes. So the plan was 2 years and then take off to any of duty place of my choice. But I kind of fell in love with the island. I think the best thing about Guam is the people, the patients, because they're really appreciative of what you do.
Right.
So I've been here ever since then, and trying to help out the community as best as I can.
Doc, has anybody named their baby Corona or COVID yet?
No, no, I don't think so. But
Any like 19s? Anybody name their
Yeah.
baby 19 or?
I can, Felix Cabrera, bless his heart, he has all these ridiculous projections, right? I can tell you the real numbers and projections coming up in December, January, February, maybe even March.
We're gonna see a surge, right? We're gonna see a surge.
Yeah, it's going to be a big surge. Well, at least in my practice,
Yeah.
because a lot of my
Surge of babies, guys. Surge of babies. Okay, not COVID.
Yeah, so it's going to be busy at GMH, but we do a good job at GMH. I think the obstetrics and gynecology aspect is probably the heartbeat of that hospital.
Right.
And I think what they should appreciate is all these new babies coming along. And certainly we have some tragic results, but very small. The mortality, morbidity is small. But then again, we have a lot of thousands of babies being born at GMH, and that's good. We need those happy times and happy moments. And I still like delivering babies. So I posted yesterday that, somebody asked me last night, when am I going to retire? I kind of laughed at it. I go, geez, I'm still the youngest board certified OB from Guam. I mean, geez. I until the time comes where I can maybe find a replacement, and that's even hard because it's so hard to recruit. And that's where the governor and the Guam can help us with, is the recruitment aspect of it, because they even increase the GRT even on the healthcare providers. And, the hotel industry, the entire industry has a, GRT or QC waiver for the entire industry. And that's fair because you don't favor one hotel or the other. Healthcare, if they're really concerned about healthcare, how to build it up, then you can consider in an industry-wide waiver for the entire healthcare community. And then that'll help us create the funding so we can recruit more qualified doctors for Guam. And we don't have to worry about this coronavirus crisis or pandemic crisis.
Right.
We're worried about shortages because you can build 2,000 bed hospital. You can build, the Navy or military have 2,000. Who's going to staff that? You can only staff maybe 100 beds. That's it.
Right.
2,000 beds just for show. But you can't staff that. No way.
Doc,
No way.
we're running against the top of the hour here, but I wanted to, because we chatted briefly yesterday about this health insurance choice bill, so haven't really heard from a doctor. What's your take on it?
I think I spoke up on it before. I think what we need to do is to allow people to have the choice, because I think the private sector is small enough where you can, we want to isolate our HR to just Cowboy Select Care or Take Care of Aetna. But in a government system, it's so big that I think allowing choices is good. And let me tell you why that's the case, why you need to allow people to have a choice. It's because some doctors will contract with certain insurance companies. And if you want to come and see me, for example, let's imagine you're a woman. Okay, you're a lady, you want to see me.
I'm imagining.
Yeah. If you're a woman, you want to come to see me, and if I don't contract with Aetna, then you can't see me. That's not a choice. So you want to make sure that you have choices of insurance companies, so you have your own choice of doctors that you can go to. And that's important. I don't see going with one insurance company is going to save much money for Guam. I think they should diversify and allow all the insurance companies, not just two, all the insurance companies should be able to participate in a Guam contract. That's my opinion.
All right. Well, thanks, Doc. 705. Yeah, we just got a letter from someone who's at St. Luke's now. That came in. Yeah. So we'll share this coming up in a little bit. But still hearing the horror stories really about people under this sole source health insurance contract. So we'll share that. Hey, thanks, Doc. Though, you delivering any babies today? What's it look like for you?
I don't know. I've been busy. You see my Facebook. But it's all good. I still enjoy what I do. And plus, I'm here alone. My wife's off island. Stuck. All right, so what am I going to do all day? So bring on the babies, bring on the patients.
Bring it on!
Yeah, but don't scream too loud.
Is there no one else? Okay, Doc.
I still enjoy what I do.
Good for you.
Keep on going.
Yeah.
All right, take care.
We enjoy what you do, too. Wash your hands, Doc. Okay. Right on. 706. Good morning on you. We're KUAM FM, Agotni, Guam. We'll take a short break, and coming back, we'll hear from the Mayor's Council of Guam. Next, they had a big meeting yesterday, so we're going to bring on the Vice President of the Council to kind of unpack the things that were discussed at 707. Good morning, Guam.
Subway restaurants across the island.
Keeping you informed, KUAM News brings you Banking 671.